Hi, what's up, guys? Welcome back to another episode on this show, Behind the Scenes of Health with Dr. Ron. And if you're new here, my name is Ronald, and I talk about everything healthcare, health tech, alternative careers, innovations, career transitions, and all of that. So if that's the kind of stuff that interests you, please hit the subscribe button. And to my returning viewers and subscribers, thank you guys for sticking around and pushing the channel. So on today's episode, I'll be talking about an interesting topic to an interesting subset of healthcare professionals, and that's the pharmacist. Interestingly, on my last live stream, somebody asked me what are the different career opportunities for pharmacists outside the traditional clinic, and I decided to make a video today to answer that question. So I'll be talking about 15 different job options or career options that a pharmacist can do if you don't want to do the bedside thing or you don't want to work in the hospital full time. So if that's what you're looking for, then I just want to stick around to the end of this video because I'll be talking about 15 of them in no particular order. So that being said, so now it's interesting or it's worthwhile to note that, these days your skill as a pharmacist, it goes beyond the traditional pharmacy work and it's begin to open up other opportunities in different areas of the healthcare space. So I'll talk about 15 of them, like I said, and different prospects and insights as to what you do there and what they look like. So the first thing is to work in the pharmaceutical industry. So this is basically working in companies that do drug development. You're looking at areas around regulatory research, regulatory affairs, clinical research, and medical affairs. So interestingly, this area is not just for doctors, because I've seen people argue that, yeah, it's only doctors that do maybe medical affairs, clinical research, and all of that. Like, no, it's not just for doctors. So pharmacists can actually be in those spaces, do clinical research, do regulatory affairs, drug development, and all of that. So you can decide to be in industry or work in the industry as a pharmacist. So that's number one. And the prospect of that is there is good prospect for career growth and development, and also specialization, because you probably be at the forefront of developing cutting edge drugs, all these new drugs that are curing cancer and all of that. So you usually be in the know of what's happening in those areas. So it's a good one. Then the second one is medical writing. Yes, pharmacists can also become medical writers, and this involves creating content for research papers, creating content for medical publications, creating content for drug information materials. When people look for persons to pass all of those information in very simple, relatable terms, especially for drug informations, then you might be the best person suited to do that as a pharmacist, right? So medical writing is one area to go into. And with the increased drive in we're in the digital age, there's a lot of freelance platforms where people can do like Fiverr, Upwork, and all of that. So there's increasing demand for that. So you have somewhere to really showcase your skills as a medical writer from a pharmacy background. I'm even trying to get a pharmacist who is a medical writer on the show to come out talk about her journey. And yeah, you might just want to subscribe so that once that goes live, you'll be the first to know. Then the next one is to get into pharmacovigilance, and this involves monitoring and analyzing the safety of medications and also reporting adverse events. So this is another specialty on its own, pharmacovigilance, right? And being in pharmacovigilance, you can also deploy that skill sets, maybe clinical research, clinical trials, and all of that. So there's really a lot to do with pharmacovigilance, and there is a high need for people to work in drug safety and compliance areas. So if you're looking for an area to get into, yes, this is one of those areas to get into. Then the next one is health informatics, where you get to combine pharmacy with data analytics and ultimately improve healthcare data management. Interestingly, I just finished my degree in health informatics, and I had a classmate, Anthony, who interestingly is a pharmacist and came to do health informatics, and now he works as an information analyst. So you might just want to look for that video on my channel and listen to his story and what he's doing at the moment. So your knowledge of informatics plays or makes a lot of difference, really, because you're able to collect data, analyze data, drive meaningful insights, and there's an increasing demand for people in the healthcare professional who understand health informatics. So if you've got a degree in health informatics, or you probably want to consider getting a degree in health informatics, yes, it's a good value for money, I would say. So you look at that. Then you talk about clinical research coordination. That's another place a pharmacist can get into. So in this area, you coordinate clinical trials, you ensure compliance, you ensure patient safety, and you ensure data accuracy. Yeah, it's a lot of work, but there are opportunities to advance in clinical research management, CRM. That's another conversation on its own. Then another area to get into is pharmacy benefits management, where you manage medication benefits, where you look at the development of formularies and cost containment, especially for insurance companies like HMOs, right? So that's another area you can do if you don't want to do traditional pharmacy work. Another area is to get into healthcare consulting. I mean, pharmacists can become consultants, right? You advise people on drug utilization, cost-effective therapies, medication management, inventory management of maybe your stock and all of that. So consulting is a good place to be in, and there are prospects because there are a lot of opportunities in advising healthcare systems on how they can improve patient care and ultimately, on the other side, reduce their cost, really. So consulting is good, so you might want to look at that. Then the next one is academics and teaching. Well, this is not what a lot of people will want to hear, because nobody really wants to maybe go back to the classroom to teach people and all of that. But you can, share your knowledge with the next generation of pharmacists in school, teach them, bring them up and all of that. So ultimately, you're contributing to research, you're contributing to capacity building of the next generation of pharmacists, and you ultimately have the potential of advancing academically. So if you're somebody looking to get to maybe professorship level and all of that, then this might be a good area to get into, that academics and teaching. Then the next one is to get into public health, really. So in public health, you focus on disease prevention, you look at health policies, you look at programs at the community level, and here you bring a lot of value to the table in terms of decision making of the people who is who, really. So it's a good area to be in, policy making and all of that. And you have the opportunity to shape the public health policies and initiative of wherever place you live in, be it in Nigeria, in the UK, in the US or Canada and all of that. So there's a lot of opportunity for that, right? Then you talk about medical science liaison, MSL. So the MSLs, they tend to bridge the gap between pharmaceutical companies and healthcare providers. So they offer a lot of expertise on drugs and therapies. And the good part, I used to know somebody who used to do MSL work. There's a lot of travel involved, and they get to sponsor your trips. You sleep in the best hotels globally. So those are some of the perks of working as an MSL. So if that's something you're interested in doing, then that window is open for you to look at. Then the next one is specialty pharmacy. So some people can just decide to specialize in medications for specific illnesses. So you might say, okay, maybe it's rheumatology drugs, or it could be oncology drugs, or it could be infectious diseases drugs. Some people are like that. When certain illnesses pop up, it's just them that can get you those medications or advise you. So you can get into specialty, practice, and it's in high demand, especially these specialized areas of pharmacy. Then the next one you might want to consider is telepharmacy. So telepharmacy, with the advent of what happened with COVID-19, we can now see what's possible in terms of the use of telemedicine and telehealth to deliver healthcare and all of that. So pharmacists can also deliver, remote medication counseling, remote medication monitoring via telehealth, and that's an area. So you can do that. You can also consult as to how people can set up telehealth practices in terms of doing the monitoring, counseling part of things. So that's an area to get into. And this is very key because there's a lot of opportunities that are expanding in remote healthcare service delivery. So you might just want to latch onto that opportunity if this is something that interests you. Then the next one is regulatory affairs. So this closely ties into the part of where I talked about clinical research coordination, because part of it is to make sure people are complying with safety, with the patient safety, make sure they get consent before trials and all of that. So, and there is a increasing demand for professionals in the regulatory space, so you might want to consider that. Then there's a compounding pharmacy. Well, this is tied to normal clinical or clinical pharmacy work. So people can specialize in compounding special medications that are probably not readily available because you're serving unique medication needs of the people. So that's an area to look at if you're looking for something different and interesting to do. And it's a niche market, so there's actually potential for growth. Then you can decide to start your own business, start your own consulting firm, start a startup. That sounds for me. Start a startup, right? And interestingly, you've got people like Pharmacist Adebakin, who runs Advantage Healthcare Africa or Advantage Health Africa. AHA, where they do all this online delivery of medications to wherever you want it. She's been able to aggregate a lot of pharmacies, maybe close to 1,000 pharmacies under her network, so that you just order, they get the drug and they deliver it to you. And she's doing absolutely well. So you can decide to start your own business or startup. So entrepreneurship is another place to go. So it's good if you're looking to shape your own career, start your own career, maybe work on your terms. But again, it's good to know that it's not all rosy out there. In fact, I'm going to look for Pharma Adebakin to come and tell us about her journey building Advantage Health Africa. I think that's a good idea. Yes, I'm going to do that. Then so as a pharmacist, you've got a lot of experience, you've got a lot of transferable skills, you've got a lot of certifications, you build your network, and you can do any of these areas that I just mentioned in this video. So if you've enjoyed this video, please give us a like and don't leave without subscribing to the channel. You can tell me in the comment section which of these ones you're interested in. I'll probably make a separate video to talk about them in detail. So leave your comments. I'm here reading them and waiting to hear from you or reply to you, right? Thank you guys for listening, and I'll be back on the next episode. But before then, I still remain your host, Dr. Ron, and bye for now.